This week's class, When Your Health Matters, the class designed to empower you to better health through knowledge and education. And I'm your host, Dr. Richard Huntoon from Advanced Alternative Medicine Center. We're located at 138 Canal Street in Pooler Park. That is in Pooler, Georgia. We're in Suite 404 of Building 400. If you have a question related to your health, we'd love to help you. You can stop into the office, but people are still a little reticent to meet strangers, etc. That's one of the benefits of our last 19 months of quarantining, etc. But other ways to get a hold of me would be to call my cell phone directly at area code 845-561-2225. Again, 845-561-2225. That is my cell phone. Please do not text that phone, as that phone is not receive text. It's not equipped for that. I will never get your text. I will never get back to you, and that kind of defeats the purpose for you trying to get a hold of me. But you can email me using the same type of technology at docrick@spineboy.com. That's DOCRICK@spineboy.com. And it's my pleasure to help you to better understanding what the concerns you have with regards to your health. This class is called When Your Health Matters. It's not up to me when your health matters. It's actually up to you. And we do these classes each week in an effort to educate you on things that you can do to help yourself. And today we're going to talk a little bit more about the number one cause of death in this country that's reported is cardiovascular disease or heart disease. Cardiovascular degeneration is probably more accurate. The different stages associated with how the heart degenerates over time and what you should look for, so that when you have a visit to your doctor, you can actually ask the doctor to do these things so that you can have a sense of what's going on with your health, and you can truly take charge of whether you're going to have heart disease or not. So the first stage of cardiovascular degeneration shows up as a deficiency with potassium and a deficiency with magnesium. Now, if you're holding more in the body, therefore it shows up as a deficiency in the blood. And if you're holding more in the tissues themselves as opposed to being in the blood, it's because the tissues are struggling to keep up. Okay, so you need to have good sources of this within your diet. So normal blood magnesium levels are 2.0 or greater. So if you get your blood chemistry done, you get a complete blood chemistry done, you're going to notice that if your magnesium levels are less than 2, that indicates that you're growing heart disease, and you're eventually going to have cardiovascular degeneration and potentially the final phase of breakdown. Normal blood potassium levels are between 3.5 and 5.2. Anything below 3.5 is indicative of a problem. So you want to know what those two levels are doing in your blood chemistry. Once those become a problem, you end up getting vasoconstriction issues. The vessels react to the potassium and magnesium imbalance by constricting in an effort to hold on to more or to normalize the ratios of what's in the blood versus what isn't in the blood. And as a result of the vasoconstriction problem, you end up creating vascular damage. Because the vessels are constricted, as the blood flows by, oxidative stress occurs, creating the basis for plaque formation and the repair product that is your bad cholesterol to start lining the insides of your arteries. Ultimately, what that ends up creating is the basis over time, large amount of time, 10, 20, 30, 40 years, is then you get a thing called a myocardial infarction, which is a heart attack. And that's because of the blocking of the arteries, because they filled in with cholesterol plaquing as a result of the deficiencies in magnesium and potassium, and the too much completely refined and processed, what I call the crapohydrates or carbohydrates, eating too many of those. And then finally, the fifth phase of body breakdown related to the heart would be sudden cardiac death. Okay, you don't come back from that. Okay, if you are fortunate enough to survive a heart attack, and the doctors do whatever they need to do. They may do open heart surgery. They may put stents in an effort to open up those arteries. Um, Whatever the case happens to be. 55% of Americans, their very first symptom of heart disease is death. They drop dead of a heart attack. It's not a good way to find out, and it's certainly not good for your family members or the people that survive you to have to pick up the pieces after you're gone. Um, and it's just a sad, sad, sad situation. And so we want to understand the 5 stages. Number 1, potassium and magnesium fall below normal levels. Magnesium again being below 2 and potassium being below 3.5. The blood vessels react by creating constriction of those blood vessels to maintain normal ratios. You get blood damage or blood vessel damage as a result of that. Oxidative stress causing plaque formation, leading to a heart attack, and finally sudden cardiac death. So what can you do to help prevent this from happening? Well, there's several different supplements that we recommend to people. Okay, we recommend Cardio Plus. We'd like to go with a gluten-free option as opposed to just a plain Cardio Plus. We'd like to go with Cardio Plus gluten-free. It's indicated when a person has heart fatigue, elevated blood pressure, muscle weakness, muscle atrophy, and we would recommend that they take 6 of those a day, 2 with breakfast, 2 with lunch, 2 with dinner. Vascular is another supplement. It's indicated with congestive cardiac problems, capillary fragility, some form of adrenal hypofunction, I should say, where your adrenals aren't living up to what they should be, and muscle fatigue, and again, poor circulation. This would be Vascular. We would recommend you take 2 or 3 of those at each meal 3 times a day. So 2 or 3 with breakfast, 2 or 3 with lunch, 2 or 3 with dinner. Next thing that we would recommend is Cataplex ACP. It's indicated for capillary fragility. It's high in vitamin P, which when you get capillary damage, you're usually having a vitamin P deficiency that we discussed way back when we talked about whole food vitamin C back in March. So we want to be appreciative of that. Lymph node swelling, kidney bladder problems, thyroid or adrenal glandular issues, whether you have hyperthyroid, hyperadrenia. You want to take 3 to 6 of those a day. 3 to 6 of those per meal 3 times a day. Organic minerals, source of organic potassium. It's an indicative of sympathetic dominance, or the fight-flight response is dominant in that person's life. They get a lot of sighing. They got endocrine hyperfunction, so we would recommend 3 to 6 organic minerals. So 2 to 3 times a day, 2 with breakfast, 2 with lunch, 2 with dinner kind of thing. That's exactly what I take. Cataplex B should be taken with Cataplex G, which we'll talk about in a minute. It's for proper balance. If taking for cardiac health, it's indicated when there's poor muscle tone within the heart itself, when you got swelling, improper heart rate, arrhythmias, general lack of energy. I take 9 Cataplex B gluten-free every single day. And for those to help counterbalance the effects of blood pressure issues, you want to take Cataplex G. G is for goat. It's a nutritional tranquilizer. It's a synergist to vitamin B1 and magnesium, and you take 1 or 2 of those per meal 3 times a day. And then last but not least, if you already have heart damage, let's say you've already survived a heart attack, or you've had open heart surgery, or if they put stents in, this, that, and the other thing, you want to take a supplement called Cardiotrophin PMG. That's going to help repair your heart. It's nutrition to help repair specifically just the heart. And so these are the supplements that we would encourage you to take. Please feel free to watch back and make a list of these. And certainly call me and let's discuss what your situation is. We'll invite you in for an evaluation. That's the evaluation that we have this month. During the month of July. I'll be happy to extend it through the month of August because of the lateness in the month that we're showing this class. But please, Stop into the office. Let's do a free heart evaluation. Give me a call at area code 845-561-2225. Email me at docrick@spineboy.com. But whatever the situation is, whether you stop into the office at 138 Canal Street in Pooler Park, that is in Pooler, Georgia, Suite 404 of Building 400, whether you call me at 845-561-2225, or whether you email me directly at docrick@spineboy.com, it's my pleasure to help you to better understanding what the concerns you have. I want to thank you for tuning in to this week's class. Please tune back in next week, same health time, same health station. This is Dr. Richard Untune from Advanced Alternative Medicine Center saying, I look forward to supporting you when your health matters.